For all your embroidery and digitizing needs, call Bees Embroidery.
Perhaps 12% of Americans are diabetic. And what's interesting is here in Pahrump, the frequency of diabetes is about 50% more than in the rest of Nevada.
Why is that?
Well, I think it's, again, correlates with inactivity. Weight is a huge factor in diabetes. And, looking at the data for our population here, we have an older population, retired, less active, living in a rural area, heavier population. Those things contribute to diabetes.
Can you tell me the causes of diabetes?
Well, the primary cause is, from a chemical basis, is resistance to insulin. Insulin levels rise when your body is resistant to it, and insulin resistance occurs due to obesity. The heavier you are, the more likely you are to be insulin resistant. Body produces more insulin, which in turn creates a vicious cycle of higher sugars, producing more insulin. And insulin itself is one of the most potent triggers of hypertension. Most people don't know that. So then you have hypertension. In addition, the heavier you are, the more you have cholesterol and triglyceride levels elevated. Again, it's not universal. I mean, all of these things that we say, when we do these interviews are general and they apply to most, but not all. There are exceptions. Just because people are heavy doesn't mean they're going to be hypertensive, have high cholesterol, high triglyceride, and be diabetic, but the odds are.
Yeah. There's two different types of diabetes?
There's what's called, has traditionally been called a juvenile or younger age onset, so-called type 1, and then the later onset type 2, that is the one that we're talking about that's more prevalent in young adults to middle age and older adults, that is really related to weight.
So what can a person do?
Well, I think, first of all, everyone needs to know that this is a curable problem. And I don't mean curable with medicine. Medicine's a treatment, it's not a cure. The cure is to shed the pounds, the body fat, because the body fat is what promotes the insulin resistance and the diabetic state. So that's a treatment. And for people that are super heavy, who have a BMI, number of 38, 39, or 40 or higher is considered excessive obesity, morbid obesity, that correlates with more disease states, which is why it's called morbid obesity. Yeah. Well, it's been shown in a number of studies that bariatric procedures to cause aggressive and major weight loss will actually correct diabetes. So that's the most extreme case of correcting and curing it.